I would say my interest in orthopedic surgery was first derived by the experience of being a patient. And when I was in my senior year of high school, I had a significant ligament injury of my knee playing lacrosse and required surgery, and was fortunate enough to be able to recover fully from that and return to athletics and play sports at a fairly high level throughout college and then through years after college. And I was impacted by the skill and the opportunity that orthopedic surgery afforded me to be able to do that. I played football and lacrosse at Hopkins. I was there in the early 70s when playing two sports was possible. It's really not any longer, but had a tremendous experience there in every way with the people that we met, the successes that we had, the team accomplishments and so on. And I felt I was blessed when my three sons all chose to go to Hopkins and play lacrosse there as well. My personal achievements in the sport I view as part of a bigger team effort, and I was a goalie in lacrosse, and you can't play that position without a bunch of other people helping you and doing it at a high level. So it was certainly an honor that I received, is greatly appreciated, and I cherish that. My kids were 2 years apart, so for 6 years I watched an awful lot of lacrosse. I love the sport, and it was great to watch them. Hopkins has a tremendous tradition in lacrosse, and for anybody to be a part of that, I think is special, and the fact that my three sons was special for me. Union Memorial Hospital in 1981 was a very different place than it is today, and in many ways in terms of its size and scope and so on, but specifically as it pertained to orthopedics. This was a relatively new orthopedic training program, so there were residents receiving training to become orthopedic surgeons here at Union Memorial, but there was only at the time one full-time faculty member. So the most significant early transformation that took place as part of my coming and then the recruitment efforts that followed were to bring more full-time faculty members here to Union Memorial. One of the attractions to me about Union Memorial at the time, one of many, was the fact that Union Memorial, as you probably know, was the first sports medicine program in the state, maybe in the region. And there were this core group of visionaries who saw the value of that, and it was very early and very formative. But I saw the value and the opportunity to be involved in that initiative, which was very appealing to me and didn't exist really anywhere else. So it was an opportunity to shape it, have a contributing role to what we've become today. We are, without a doubt, the largest, most comprehensive sports medicine program in the region. Union Memorial Sports Medicine was the flagship sports medicine program in the region before there even was MedStar. As MedStar has embraced the value and need to expand sports medicine across the region and throughout the system, there has been some risk associated with diluting the Union Memorial brand in deference to the MedStar brand. And that's still a process that we work through and try to find a balance for, because we know that people recognize Union Memorial Sports Medicine as a signature brand at this institution, much like they do the Curtis Hand Center, for example. The financial strength of MedStar, a $5 billion corporation with its resources behind a sports medicine program. The National Rehabilitation Hospital and the network of physical therapists and athletic trainers. The benefit of the MedStar commitment to sports medicine benefits our patients in any number of ways. We have, again, great geographic diversity, so patients can generally find a highly skilled and qualified sports medicine provider fairly close to home or work. When they go to the facilities that MedStar has developed for our program, they will find a full service experience, so it may not just be an orthopedic surgeon, but it may be medicine, neurology, dietary, nutrition, and also the physical therapy, rehab, injury prevention programs that exist. We do a fair amount of work in educating coaches, trainers, players at different levels about aspects of their sport. And the other is research. We need the outreach. It's very important for us to be able to get our world-class medical services out to the people closer to their homes and places of business. There are a number of changes that we envision happening as we continue on this journey towards becoming a truly integrated regional orthopedic network. We have tremendous expertise in every area of orthopedics, and a couple of the things that we were able to achieve under this regional format were, for example, to develop an orthopedic oncology program, which we didn't have before, a pediatric orthopedic program, which we didn't have before. So when we look at the entire spectrum of care of orthopedics, from kids to senior citizens, from athletes to the elderly, to the injured worker, and so on, we have the expertise and the geographic diversity to take care of those patients throughout the region, and that's an important change. So we're taking our services to the community in a more proactive way than we've ever done before.